Looks like a good group of people getting on. So since the suicide postvention training, I think I told you guys, those of you who are at that at the end of July, that that was actually my last time at the hub, and I'm now over at Positive Directions. So, but of course, still planning to be engaged in this work. But I don't have access to hub email anymore, so I don't know how many people we're expecting. So as soon as I see the chat kind of start to die down, we'll kind of get going, and people will join us as they may. I'm going to share my screen in the meantime, but go ahead and keep saying hi to each other and introducing yourselves in the chat. Oh, it's fun to see all these folks. Okay. Can people see the agenda on the screen right now? Everyone's muted, so I don't know. I think you probably can.
We can see it, Margaret.
Okay, thanks. So what I'm trying to look at here is I don't think I can monitor the chat effectively while showing my screen. So what I'm going to ask is, can I get a volunteer? Ask Jeff to volunteer because I saw his face first. Jeff, can you let me know if there's anything happening in the chat where we need to stop and discuss stuff?
Yeah.
Thanks.
I'm not connected via AirPods. This is a pain in the neck.
Definitely for you.
I feel bad though, because you don't worry about it. Okay.
So for people who are still
Okay.
for people who are still joining, please introduce yourselves in the chat. We're going to get going in a minute. I've got the agenda on the screen, and you can see that our main purpose is going to be today to kind of talk about what's happening at the state level, follow up on the suicide postvention response planning work that we were doing over the summer. Let me scroll down here a little bit. We want to have a little time for updates from the community, anything you've been doing that's suicide related. And at the last quarterly meeting, we talked about creating a prevention subcommittee, also postvention subcommittee, but now we have all these community-based postvention subcommittees. So I think we want to identify more clearly how the prevention subcommittee is going to work. It looks to me like we have a fair number of participants, 27 right now. So let me officially get going. I know on the screen it says I'm Janice Anderson, and that's because Janice Anderson from the Hub at RIASAP is the official host of this meeting, but had to step away today. So I am Margaret Watt, formerly of the Hub and now the Prevention Director at Positive Directions, hosting the meeting today. And thank you for joining us. Thanks for introducing yourselves in the chat. I'm going to mention that a bunch of times. And we're going to jump on into the big thing that happened yesterday, which is the state has now released the new 5-year suicide prevention plan. Unmute yourself and just tell us if you were in attendance at the meeting yesterday. They had a 2-hour launch. Was anybody there?
Oh, this is Jules Calabro. I was there. My dog's barking, so I'm going to go back on mute.
Okay, Jules, thanks. So as Jules knows, they had a great little video to kind of launch, review some of the great work that's been done. They went over the process. There was a lot of discussion, and then kind of when it got time to present the plan's huge. It's like over 100 pages. And so they were like, here it is. We've got to digest it more. I would say I haven't had time to digest all of that, but I'm going to share with you some notes I took at the meeting yesterday. We're going to pull up the plan on screen so we can all kind of look at what's in there and start to think about it. But, you know, I'm sure you can understand when I say I was at a 2-hour meeting yesterday, listening to a whole bunch of stuff, and I've not digested the plan. So we're all kind of looking at this together. By They told me that after October 8th, they will have posted, the plan is on the state website, which is preventsuicidect.org. By October 8th, they will have had their board approve the minutes and the video from yesterday's meeting. So you'll be able to watch all of that on the state website. So I'm going to scroll down here to some notes that I took while it was happening. And Jules, I'll ask you to jump in with anything else that you heard that was notable. One thing they wanted to do was just highlight the fact that in the last 5 years, a lot has happened in Connecticut around suicide. There's a lot more structure and policy and coordination across all the involved stakeholders, which is amazing. And at the same time, suicide is becoming a larger problem. So there's good and bad. I think you could question, I certainly question, you know, would it have been even worse if we weren't doing all this work in this space? But as you can see on my screen, the Connecticut Suicide Advisory Board, CT-SAB, only officially began in 2012. And that was already a really great accomplishment because suicide was happening in two separate silos, at DMIS on the adult side and at DCF on the child side. And they came together and created a statewide entity that is co-chaired by both agencies. One of the early things they did was launch the One Word, One Voice, One Life campaign. And they recently did a phone survey and found that 83% of state respondents actually recognized the campaign. I was extremely impressed by that because I didn't think anything, honestly, in the social services had that kind of name recognition. Over 23,000 QPR trainers have been, no, that can't be right. That must be people have been trained in QPR. I'm going to edit that. That cannot be trainers. They, you know, as of last year, as you all know, the regional suicide advisory boards were created, and this is the regional one for Southwest Connecticut, which is managed by the Hub and funded by DMIS, but is completely, you know, based on your roles as volunteers and coalition members, open to all. Anytime you know anyone who wants to join it, a couple of other things that they highlighted. I think you've seen this. I think Danique has presented this at previous meetings. I'm hearing an echo. I don't know if that's me or somebody else. Maybe mute yourself if you aren't already. I'm highlighting here a book that CT-SAB created called Gizmo's Possum Guide to Mental Health. It features an adorable, tiny, I've seen him in real life, service dog named Gizmo, and it's giving little kids, preschool and kindergarten through second grade, a way to talk about mental health. That has gone statewide and beyond the state with an actual health curriculum. Other things that have happened in the state, the Jordan Matthew Porco Foundation, which runs Fresh Check Day, and other terrific suicide prevention initiatives specifically focused on youth and young adults. They developed the For What's Next curriculum. That's like a coping skills curriculum, 5 sessions, drop it into any classroom setting. That was new as of about 1.5 years ago. There were a lot of good news things to report. So I would encourage you all to kind of listen to the video when it's on the website in a month, in a few weeks. But these are just things that struck me that I highlighted. They talked about using the ASQ suicide risk screener in children's hospitals now. And I don't have the graph, but one of the children's hospitals that has started using this had a really impressive graph showing the number of kids. So these are kids coming in the ER for anything, right? Behavioral health or medical health. They had a graph showing kids presenting and being identified through the screener as having suicidal ideation. And they broke that graph down into those who were there for a behavioral health reason and those who were there for another reason. And it was, I would say, at least half who were there for another reason. So if they weren't doing a suicide risk screening, these kids would not have been identified. They were not there for a behavioral health concern. And it was a lot of kids that they were finding. So that's a really great prevention effort. And I think the goal, of course, now is to say, we've got this data, let's roll it out everywhere. Janya Padilla, who is not on our call today, at Health 360, has trained almost 150 future doctors and nurses in the 2-day assist suicide intervention training, which I think is an amazing asset, and building suicide intervention training into medical training is fantastic, because I think we've talked about this before, but something like 30 to 40% of people who die by suicide visited a medical professional in the month prior to dying. But they didn't visit a behavioral health professional necessarily, they visited a regular doctor. And if doctors don't know what questions to ask and aren't screening, they don't have that opportunity to intervene. Yet people may be in front of them talking about sleep issues and upset stomach and things that are symptoms potentially of, anxiety or depression. NAMI's young adult program had sent, in the last 6 months or something, sent more than 500 caring cards to young adults who had been hospitalized for some type of suicidal emergency. I want to take a moment to talk about that caring cards model. Model is kind of a grandiose word, but it is research-based, and this is research going back to World War II. And when someone has been in a suicidal or mental health crisis, research says that people following up and just sending them a card in the mail that shows you took the time to think about them, put pen to paper, get a stamp, and mail it. Caring cards save lives. And the caring cards model actually started with psychiatrists and psychologists, therapists, touching base in writing with patients in between visits. And so I'm just putting that out there as something we can all be doing. Some other notes that I just wanted to summarize from what I heard yesterday. 4-year data on suicide deaths. Deaths actually increased from 384 in 2015. They increased every year to 486 last year. The suicide rate has increased. It's still 3/4 of suicides in our state are middle-aged white men. There are some differences between men and women in attempt. There's significant differences in attempt rates. There are differences in the methods that are used by men and women. We know suicidal ideation continues to climb in youth and young adults and in many ages, but that's still the largest population. You also, of course, have risk factors like LGBTQ and veterans. Taking it down to our region down here, Region 1, Southwest Connecticut, the 5-year suicide rate over that 4-year period was 7 suicides per 100,000, which was the lowest in the state, and literally half the rate of the kind of Hartford, Middletown area, which was 13.9. So I could say maybe we're doing something right. Maybe we just have a lot of hospitals where people can get to and be saved. But also we want it to get down to 0, right? 0 suicide would be an aspirational goal. Something that I know we talked about at the last quarterly meeting when we had Dr. Carol Tassone talking sort of in the middle of the quarantine period, talking about shared trauma. We were all thinking, what is happening with suicidal ideation and suicide now, and what will be the long-term impact of the quarantine and COVID on suicide. I don't think anything's changed. I think everyone in the profession is still assuming there is going to be a big jump in suicide. It's just that, your PTSD kind of thing takes a while to hit. Dr. Manching Ye from the F.S. Du Bois Center has reminded me that, after the recession hit in 06, 07, it was 2 years before there was a big bump in the mental illness and suicidal rates. So at the moment, here we are in September of 2020, 6 months into the whole COVID crisis, we actually have a 20% decrease in suicides compared with the average of the last 5 years. At the same time, we have a 20% increase in overdose deaths in the first 6 months of this year compared with the first 6 months of last year. So this is all, I think, the most up-to-date data that the state has. It was just presented yesterday. And on the screen, I've shown a couple websites, where you can get the Connecticut adult data on behavioral risk factors and the youth risk behavior survey data. That's the CDC survey in Connecticut. We call it the Connecticut School Health Survey. And these are the websites where you can get lots more data. So that's me reporting on things I learned yesterday before we look at the suicide prevention plan. I want to ask for Jules or anyone else who was there at that meeting yesterday, unmute yourself and add any comments, please, on the state launch or the state presentation yesterday. Ask any questions, and then we'll take a look at the actual plan.
I just want to say, Margaret, you did a great job of recapping that. I think that those were all the main points. You know, they went through a lot of data. We're getting better and better in Connecticut at being able to track that data and use that data, you know, going forward. So there was a lot of information, but I think you hit on all the key areas. Thank you so much.
Oh, thank you. So I'm going to list for everyone here. So you'll get these notes in some format, but you can also see it on the screen right now. So the website is preventsuicidect.org. So the lots of information presented yesterday will be available after October 8th on this website.
And if you haven't joined their mission, it'd be great to go onto that website and join the mission. That way you kind of get more current information in an ongoing way.
Good point. So again, the website is preventsuicidect.org, but it's the website run by the Connecticut Suicide Advisory Board. So when we say CT-SAB, it's the State Suicide Advisory Board, and this group is the regional SAB, the RSAB for Southwest Connecticut. What I'm going to do now is, well, actually, I'll go back up here. This is the link to the new state plan. How can I find the chat here? Okay. I'm going to actually throw it in the chat so you can access it if you want to pull it up locally. Otherwise, I'm going to pull it up on screen and we can look at it. Since I just put that in the chat, just a reminder, if you haven't introduced yourself in the chat, please do, because that's going to be our attendance. And where do I have the state plan? It's not it. Oh, here. Okay. So if you remember seeing the previous 5-year state plan, it looked like this, but it had a black cover. So it's got a different date and a white and yellow cover. So if you start printing them all out, you will keep them separate. Like I said, it is more than 100 pages. So I'm going to show you the table of contents first. And there's, you know, there's statements from the DMIS and DCF commissioners. There's philosophy. You can read how this was developed. There were really a lot of stakeholders involved in developing this. Everything from focus groups with high-risk groups to a statewide survey of those involved in suicide work, all kinds of other data gathering. And just want to show you here, you know, starting at page 18, you can see goals, objectives, and examples of strategies, the areas of focus that the board has, because the CT-SAB board has a whole bunch, I think 6 or 7 different committees that meet usually monthly, and you can be involved in any of them. And it's really easy now that everything's online. But, you know, there's a zero suicide group, there's a gun violence group. There are groups really working on statewide strategies to address different things. What's really useful, I think, about this document that we can all probably think of ways of using it in our work is all this data and information and strategies broken down by everything from, you know, race, ethnicity, mental health conditions, opioid use disorders, occupations, first responders, really all these different kind of risk categories, and a huge appendix of different resources. Okay, so I am going to go ahead to the goals page. what I'd been hoping, honestly, was that they were going to let us have the slides from yesterday, because I wanted to highlight a few slides, but they aren't going to send them out until the middle of October. Okay.
Margaret, it might even be a good idea if we want to, let's say, present some of this information, to create just a small slide deck of the main goals, some of the data, you know, just a couple slides of the data. I can see if I can ask Tim Marshall if that might be something we can do and
Yeah,
help
I
out
think,
with.
well, and Jules, I don't know why my document just went sideways, so now I have to figure out. Oh,
Oh,
what did I
the
do?
little,
Got it, there it
you're
is.
pointing,
Okay.
there it is.
Didn't even
Just an
realize
easier
that
way
was
to get
a
the word
thing.
out to people, because most people
Yeah.
are not going to read a 111-page
People are not
document.
going to read this much, right? So Heather Spada, who's part of the CT SAB, I was in touch with her after the meeting yesterday and asked if there were any slides we could share. And she said, not yet, but they are going to try to put something like that together.
Maybe
So
I'll reach out to her, see if she wants any help with that.
yeah, that would be great, Jules. And I think definitely by our next meeting, either we'll spend time going through that slide deck or send it out depending when they get that together. But I did want to at least kind of show some of this here. I can't tell if this is big enough for you to read. Maybe I'll do it like this. So the first goal is integrating and coordinating suicide prevention activities across all sectors. And that, really means building it into all kinds of things that all of us do. So I'm not going to spend a lot of time on that here. I'm just going to say that within our region, we've had folks involved in this work, and we've got folks on the invitation list for this group who represent health departments, crisis services, school systems, people in recovery, people who have lost someone, law enforcement, EMS, colleges, a whole bunch of different areas. But really, if we're trying to prevent suicide, we need some of everyone. And then we need them to, when you come to these meetings, you need to bring it back to whoever you're working with. So please always think about who else could be on this list, who else could be invited, and what way they could get involved. Let's see. They're going to work on public-private partnerships. So goal 2, develop, implement, and monitor effective programs that promote wellness and prevent suicide and related behaviors. So this is where the kind of mental health and promotion piece fit in with suicide. What I want to highlight here that I think we all have to bear in mind, and we all have to be talking about at the local and state level, is that there's really not funding for mental health promotion work in the state of Connecticut, right? You have local prevention councils who are funded to do substance use prevention work. They usually try to do some suicide prevention and mental health promotion because they're so linked together, but that's not what the funding is for. So for example, this year, the LPCs are funded really explicitly to do vaping prevention work. There isn't, and that's because it's federal block grant money for suicide, from the substance abuse block grant. There isn't a similar kind of allocation of money for this type of work locally. So I think one thing we all have to be thinking about is advocacy around getting funding for this type of work, not just suicide, but the primary prevention, which is way downstream, like before someone gets to suicide, when they're struggling with their mental health. So I think, that's something for you guys to talk about when you're talking to legislators and town elected officials. Goal 3, promoting suicide prevention as a core component of healthcare services. That is increasing. I think we see it all the time, but I don't know that it's increasing in a coordinated, rolled out way. So that's another place where different people here have a way to have a role to play, right? Town health departments can make sure that, the health efforts are, where they coordinate. They're not usually providing direct healthcare services, but, how do we build in suicide to that? I know when I was at the Regional Mental Health Board and at the Hub, we often coordinated with a variety of health providers to do Get Your Checkup from the Neck Up in October, which was really a whole broad-based mental wellness, substance use, suicide screening, and doing that at things like flu clinics. Hospitals and healthcare providers are doing more around this in terms of screening, but it's one thing to screen people and see if they're suicidal, and it's another one to actually follow up on the screening results and go, are we intervening appropriately? Are we referring appropriately? So I think that's really important. Janya's work training doctors and nurses to really recognize this and have that conversation is huge. I know New Vance Health, because I've been working with them on suicide prevention efforts, and they are really committed to and writing grants to try to work on that, to bring in more training for staff. Here's a sub-objective is working with emergency departments and other healthcare providers to provide alternatives to emergency department care and hospitalization. So this is where I will mention some ongoing work that started with our catchment area councils that is continuing, where we have a statewide group that's really working on legislation around peer support services and always thinking about funding for peer support services, because there are a lot of peer-run alternatives to hospitalization that can help people in a suicidal crisis. Again, it's about awareness, but mostly funding to try to implement these things. Goal 4 is reducing access to lethal means. So, you know, you may all be aware of this, but almost any time there is any type of policy change, local ordinance change, practice change that reduces access to means of suicide and homicide rates go down. So the idea that someone who's suicidal is going to attempt no matter what is really not true. If they were going to try to overdose on pills and the pills are all blister packaged, which is something Ingrid has worked on for a long time as, you know, an overdose and substance use prevention method. But if it's too hard to access those drugs, people don't necessarily overdose. If it's too hard to get the bullets out of one locked cabinet and the gun out of another, people don't necessarily do it. Towns in like Australia, there's some data I saw last year, towns in Australia that made changes around gun, you know, how to lock up guns or registration of guns or whatever, immediately saw a change in suicide and homicide rates. So I think this is an important goal. And part of it is having healthcare providers ask about the means that are available to someone when you're working with someone. So guns in particular is one of the issues. Those of us who are on this call who are from Norwalk, I'm sure are aware that there was recently a suicide at a gun range. I actually didn't know there was a gun range there, but someone went in and killed themselves in the gun range with the gun from the range. And apparently that is a thing that happens relatively frequently. So there's another sub-objective here about partnering with firearms dealers and gun owners to incorporate suicide awareness. And I know that for Norwalk, for our postvention committee, which we'll be coming back to later, one of my goals is to see if the gun range owner wants to be part of our postvention planning committee. And goal 5 is around data, state and national surveillance systems. So back to what Jules said before, we have more data all the time. There's good data. You can also visit the OCME's website to get current suicide data. And the hub will be, you know, trying to provide regional data whenever it's available. And also this coming year will be the hub's year to do another regional priorities report and data gathering. So those were the 5 main goals, and I'm trying to remember. And so then those are the 5 main goals, and then the kind of strategic focus areas are building capacity, building infrastructure in the state. So we know this group here, this is only the 4th meeting of our regional suicide advisory board. So we're still in our infancy, right? We're going to build more subcommittees, do more work, building awareness about the resources that are available, and advocacy. So That's all I'm going to summarize here from this giant plan. I want to open it up to discussion at this point about any of these goals or strategies or just initial thoughts you have about how does this relate to what we are doing in our work. Go ahead and unmute yourself if you want to comment on any of that.
Hi, my name is Demetria Nelson. I just wanted to introduce myself to everyone. I'm the new commissioner for the Greenwich Department of Human Services. This is the end of my third week here. So I'm looking forward to working with everyone, and I'm in the process of learning what's currently in place here in our department in terms of appropriate screening and referral. So that we can connect our clients to resources. In my former position, I was at Bronx Care Health System, where we were awarded a grant for the Zero Suicide Initiative. So I was very involved in it. So I'm looking forward to being involved in this process. So thank you.
That's great. Well, welcome, and Greenwich is a great community to work in, and GDHS has done a lot around integrating our behavioral health screening tool into work that they do and connecting people, and you've got a great team over there. Glad to have you at this meeting. Any other comments or thoughts about any of this? And I know that just looking at 5 goals that are pretty broad is not at all getting into the weeds of it, but it's too many weeds right now, right? But I'm sure you've all been thinking, you know, so, or I guess I would ask you to think, we are a new group, right? We've been here for a year. We've had 4 meetings, one of which was, you know, rescheduled in the middle of the quarantine. The last one, we went ahead and we already did a 3-day suicide postvention planning training. So we started moving on postvention, but I'm sure you guys have ideas about what the needs are, what the things are we want to work on in the region, and go ahead and brainstorm if you want.
I know one of the things that would be nice to have would be like a 24-hour warm line. I've given out my business card a lot over the last couple of years. And since the pandemic started, I've gotten an average of about 3 to 4 calls a week of people dealing with depression or suicidal ideation. This past Monday, I had 3 calls in a day. And one of the calls came from Vermont. A young 20-year-old just joined a sorority, and her roommate happened to be a member, or her mother is a member of our catchment area council. So daughter called mother gave my phone number, and I ended up talking to not only her for an hour and a half, but all of the members of her sorority as to what just happened, so that everybody there was comfortable. And at the conclusion of that conversation, they decided that if there was not one, they were going to start a peer support group in their college.
Jeff, that's amazing. That is amazing. Good for you. I think that just points to something so important. So I want to highlight, I'm typing, as you can see on, wait, am I sharing my screen so you can see? Did I forget to reshare? I want you guys to see the notes that I'm trying to take as we go along here, so you can tell me if I'm missing anything. But that was Jeff Santo talking. Jeff is a recovery support specialist, which is a peer certification in the state of Connecticut. He's the executive director of Ripple, which is a peer-led support organization. And Jeff, when you're talking about having a 24-hour warm line, I want to highlight that you're saying warm line, not hotline, because we do have 24-hour hotlines, but a warm line is different. It's, you know, it's not a crisis, but I do need to talk. And we do have a young adult warm line in the state of Connecticut. For anyone who doesn't know, that's the young adult warm line run by Advocacy Unlimited. That's 12 to 9 every day. Down here in Southwest Connecticut, there's the Soundview warm line that runs 9 a.m. to 9 p.m. since COVID started. But there isn't a 24-hour warm line. And Jeff, do you want to go ahead and just update people? Aren't you now running a support group a couple nights a week?
We are doing a pilot program. We have purchased a full Zoom license, and we're starting with Tuesday and Thursdays. It's going to start on September 15th. And it's going to run from 10 p.m. to 12 a.m. to start with. And we already have had a lot of positive feedback from peers in the communities who said that, you know, it's nighttime and early morning when they're the most stressed out, when they're the most alone, when they can't reach out and talk to somebody. So while we're running these groups, we are going to try to collect as much data as we can to who's attending them, the age range, professional careers, if they're members of the veteran or first responder community, LGBTQ, just trying to get a feel for who's out there and who is going to be using the service the most. And eventually this is something we want to expand to 5 days a week and eventually all 7.
Jeff, how can we all get the word out about this? Do you have a flyer you can send us? And I take it it's an online group. So do you just have a link you want to provide, or do people email you and then you send them the link?
I am going to put the link to the page on our website in the chat. And you can access this through the standard Zoom methods. You can either come online with the Zoom link. There's the one-tap mobile option, and there's also a dial-in.
Great. And is there a flyer that can go around?
I have a PDF file. How do I share that?
You can drop that into the chat too.
Oh, cool. Let me see if I can figure that out real
Kate,
quick.
I thought you weren't coming, but that's great. Oh, and Jules, thanks. Jules gave us the warm line of the Beacon Health warm line, which is great.
That's 9 to 5, but and it's also peer run,
Yep.
which I think is just awesome.
I'll add the young adult warm line, which is oh, yep, there's the PDF. Thanks, Jeff. So other thoughts from anyone? I mean, we talked about goals of, you know, reducing access to firearms or other lethal methods. We talked about infrastructure, advocacy, funding, integrating suicide efforts into healthcare, integrating suicide work across sectors. Any thoughts about our region or needs, anything like that?
Can I just ask a question? Do we have any idea as to how the One Voice, what was the success? What made that a successful campaign?
I don't know, but they may know. Do you know, Jules? We can ask that question.
I don't know, but we've certainly, I mean, everybody's really gotten the word out. I think, I don't know, but I love it. They had a wonderful video that they had initially rolled out. And by the way, if I can just mention really quickly, given the pandemic, we've been working with Rich Wright Productions to create some very small video shorts that are part of the One Word, One Life part of that whole campaign, that they're like 6-second video clips, but they're also tailored to folks who may be especially vulnerable during this time. So there's like one for healthcare workers, one for youth, veterans, the elderly, as well as first responders. So those are going to be rolling out shortly. And we're going to use a variety of methods to get that information out, but it's all the One Word campaign.
That's great. So Jules, is that Beacon Health doing that?
It's really out of the Suicide Advisory Board. We're working with the video production company, but it's really all of us working. It's, you know, it's a multiple organization working together.
Okay, that's great.
May I ask another question? Don't want to hog the time. Is there a blueprint as to how we should or could break down the priority areas and then sort of form committees to sort of address each one, or are we on our own to create that framework?
So I would say, number one, no blueprint yet, because nobody even has had a chance to read the whole document yet.
Okay.
I'm not sure, though, that like at the state level, I think all those various subcommittees that they have are going to stay in place. I think they're kind of treating them as standing committees now. So they are kind of organized around different areas of suicide work, like, I don't know, there's one around the veterans, and there's one around, zero suicide and whatever. So those are open to everyone in the state. So I think a question, I think your question is good, because it's, what are we doing in the region? Do we mimic that, which is a lot of subcommittees. So I'm guessing we probably wouldn't, but would we, for example, want someone from our group to be in all of those statewide committees and be able to report back to us each time? That could be useful. And are there subcommittees that we want at this level? So last time we said we wanted a prevention subcommittee. A few people sent me texts or whatever and said, I'm interested in a subcommittee, but it wasn't enough to be a real subcommittee. So I think I'm basically just acknowledging Kate's point is, what's our structure? What do we want? And do we want to match some of these areas that are in the state plan? Maybe a next step is really going to be at our regional level. Do we want to have a few people who want to sit down and really go through that and make recommendations for our region and bring them back to this group? Does that sound like something that would make sense?
This is Jules. I wonder about both. So we should be taking the ideas that the statewide come up with. And if we come up with certain strategies locally that we find are really effective, we should share that statewide. I'm not sure if, I don't think that was the answer to the question. I think it's important that we work at multiple levels.
Well, I think, so I think this is a good structure issue to come back to and keep thinking about, because I think, maybe what it is, well, maybe let's take a minute right now and just kind of canvass. If any of you who are on this call are already part of one of the state subcommittees or initiatives, can you just put that in the chat right now? Because maybe what'll happen is it'll turn out that, Nancy's on one subcommittee and Kate's on another and Jules is on another. Maybe we already have some of these connections to the state level, to our level, and we should formalize a little bit of, how do you guys share back to us? How do you bring stuff from us to them? And then maybe we go, where are the gaps? So let's see if anyone's putting anything in the chat here. Kate, are you still part of the Porco Foundation board?
Yeah, you already mentioned the two major curriculums, the Fresh Check Day and for what's next. So like a lot of other entities, we're rolling over into the new virtual world and how to deliver those things in a way that people are still able and willing to use them under the current conditions. So we have a couple of fundraisers going on at the moment, which are kind of fun. But I'm not attached to any of the state level stuff. So I guess what I was thinking was, if these are the priorities, like how do we as a region decide how we want to get the word out about those priorities? Like, do we have a, access to means committee and campaign, and, how do we manage those things? Because this all gets like unwieldy.
Yep. Yeah. I think it's a really good question, right? Because with the meetings we've had so far, we've usually had someone from the state. Nobody is here from the state SAB today. Jules and I are just in those meetings, but we didn't have like Heather or Andrea or someone here today to report from their end. Danique's usually here to report on what American Foundation for Suicide Prevention Connecticut chapter is doing, since her daughter had surgery today. She sent me an update that I'll share. But reporting out is also different from saying, how do we implement a lethal means campaign? Is there one that's developed that we use? Is there none, but we think that's such a priority down here that we're going to create one and then we're going to share it back? Am I summarizing what we're talking about here correctly?
For me, yeah, I'm just curious as to how we can parse this out into manageable components for everybody to feel like they can contribute and we can get something done.
Well, any other thoughts from anybody here?
I like the idea of formalizing the relationship to the state subcommittees in some way with this group. And I'm not currently I'm not currently attending any of those, but I would be willing to do that and bring information back.
Great, thanks, Nance. So you would be willing to kind of be the official link to one of those subcommittees, whichever one it might be, right?
Right.
So maybe that's it. So based on the chat, it looks like the connections that we have to state groups, we have Kate, who's on the Porco Foundation board, which is, they're part of CT SAB like the rest of us. Lee, you're on what looks like it must be the Connecticut EMS Advisory Board Mental Health Advisory Subcommittee. Is that what that is?
Yeah, that's that.
Okay. And are they part of the Connecticut Suicide Advisory Board in any way?
So I'm not sure. So I'm fairly new to it. This is like my third meeting with them. So I can get you more information. That's why I wasn't sure whether that was relevant to what you're trying to get the feedback from or not. But
yeah, let us know more about that, because that sounds like a useful thing to, this same issue is relevant anyway, because if the EMS advisory folks have work going on in this vein, they may have stuff to share to us and vice versa. So keeping all those things connected is important. So it looks like we don't have folks attending all those subcommittees. I've gone to one or two of the zero suicide subcommittees, but maybe the question right now for the rest of you, and then we'll move on to the next agenda item. But I think maybe the next question is there anyone else like Nancy who's willing to say, I will start to attend one of these statewide subcommittees and I'll be the liaison to our region? So
Nobody's saying anything, so I may say something. So I know that at some point we're going to hire a Region 1 person. So I don't want to commit, but I'm involved in the just regular SAB. I just want to give you a response because I didn't know if anybody else was talking.
Nope, I don't think anybody else is talking. So maybe the new Region 1 person from Beacon Health. Okay.
So I said I'm not leaving this position. I'm just keeping you guys if you'll have me.
Oh, no, of course we want you, Jules. Okay, well, if people, think about it more and decide they want to, that'll be great. And, oh, wait, okay. Susanna Lewis from Silver Hill Hospital would be one of our volunteers. That's great. And Susanna Lewis. So what we can do after this is those who are thinking about it or are signing up, obviously look at the list of subcommittees and decide which one you're each going to, and then we'll kind of figure that out. And so there are a couple people in the chat who are like, I'm thinking about it. I'm just going to write we're going to think about it. Nobody has to commit to anything. Sarah, Kate is saying, what's the list of the subcommittees? So I'm wondering if it's really, if I can find it quickly on the Prevent Suicide CT page. Here are all their agendas and things. Where would we find their subcommittees? No. Okay, well, here's a way to see the list of subcommittees. So all I did is just pull up a recent agenda of the CT-SAB full board. And here's where you can see the list of committees on the screen. So there is a data and surveillance committee. I knew there were a lot of committees. Look at this: data and surveillance, intervention, postvention response, lethal means, zero suicide and clinical work group, advocacy, attempt survivors lived experience, armed forces, and the state conference. So that plans the annual state conference. So there are 8 committees. I'm leaving that up. Maybe throw in the chat any thoughts you have on that, if that helps you make any decisions or anything like that. Okay. I wonder if I can cut and paste that onto my screen. Okay. Advocacy, attempt survivors, and something else. Jeff, I can see someone saying something in the chat. Can you tell me what else they're saying?
See, we have Jillian saying, possibly I am on the Trumbull Postvention Committee and was involved in advocacy, but time is limited, one-man show. And then from Nancy, I'd be interested in intervention, postvention, or advocacy.
I think intervention, postvention is one thing, Nancy.
Right.
Okay.
And either one, I mean, either that or the advocacy I'd be interested in.
And Susanna says data, lethal means, or armed forces. Okay, good. All right, thanks guys. See, this is moving along. I mean, even if we have only those links to start, that's already great. Good. Okay, so I'm going to go back up our agenda. We're actually pretty much right on time here. So for the other part of the statewide update, so we've talked about the new plan. You know how to access it. As I mentioned, Danique isn't here today as AFSP chair, so she sent me her update. And here it is on screen. First of all, actually I added this. AFSP has now put all their 2020 fact sheets on the website, so you can get the national figures and the state figures. And this is just, you know, as of the data that I showed you before was the 2015 to 2019 data from CT-SAB. So here's how AFSP shows Connecticut's 2020 data. As you know, the hub will probably create an updated one with the newest data, so you can get those kind of infographics from the hub website. But as you can see, suicide is the 11th leading cause of death in Connecticut. It's the 2nd leading cause of death for ages 10 to 34. There were 419 deaths by suicide at the end of 2019, which was a state rate of 10.57 last year. So remember that what we just saw CT-SAB saying was the 5-year rate for region 1 was 7.0, but last year that was for a region. But the rate at the state level is basically 11. We are ranked 45th in all the states, so we do have a relatively low suicide rate, but you know, no rate is a good rate. And there's a back to this page, which is not popping up, but on the back, they talk about some of the resources available. This is a statistic over here that I think is useful to highlight when you're talking to people, is that more than 3 times the number of there are more than 3 times the number of suicide deaths compared to alcohol-related motor vehicle accidents in the state. And nationally, by the way, nationally, more people die by suicide than die in car crashes every year. So, see the chat flashing. Is someone commenting on something?
Yeah, we just had one new comment from Cornelia from the Trumbull Counseling Center. It says, the intervention and postvention response, since I am part of postvention planning.
Oh, okay, great. Thanks, Cornelia. Where did that go? Okay, that looks wrong place. I'm just adding her down here. So you know what? Maybe that solves. So Nancy, then maybe if Cornelia does intervention, postvention, maybe you do advocacy on our behalf. Would that work?
That works.
Awesome. Great. So I will let those of you who signed up to be a liaison to one of these committees, you saw the website, you can go there, you can figure out a way to access that committee and ask to be on that list. And everyone, if you haven't already, you can go to, at the top of the Connecticut Suicide Advisory Board website, there's a place where you can subscribe to their emails. So just going back to the AFSP update here, hopefully you all know that AFSP is this amazing resource in the nation and state. And this fall is their walk season, which is the big fundraiser and awareness raiser season that happens every year. So usually we have that amazing Out of the Darkness walk in Westport that raises a tremendous amount of money and awareness and is, I think, always very touching and moving. So this year, the walk season is basically going to be virtual. The Connecticut walk season, it's called Out of the Darkness. They launched last week. The theme this year is experiences. And Danique is asking us to, you know, check it out on Facebook Live next Tuesday. Walking is usually during October, but now it can be anytime. If you or your family or your friends put together any kind of walk, virtual walk, if you're actually strolling in your neighborhood, take pictures or videos, please share them back to AFSP Connecticut. She asked that everyone tune in to their closing ceremony on November 7th. And I would say, you know, this is a fundraiser for AFSP, which develops, you know, data advocacy, strategies, curriculum, all kinds of things that benefit people in this country. I think their website has amazing resources. And for everyone, for people who are considering suicide, for someone who's attempted, for a family member who's lost someone. So this is my push to say, if you can support their fundraisers, check them out on Facebook, see how you can share. And then she highlighted that International Survivors of Suicide Loss Day will be right before Thanksgiving. And she said that she will have more communications to come. Okay. So anyone here who's involved with AFSP that wants to add anything there? All right, so back to our agenda, and this is where I probably can start talking a lot less, I hope. We are going to move on to the regional training that was just held, funded by the Hub at RIASAP with DEMIS funding. And that was a training that we held with Tom Steen coming down to the region. We did have something like 90 plus people attending. Which our goal was to have teams from all 14 of our towns, and that happened. We really pushed to have public health, public safety, crisis or treatment people, community members who were, you know, loss survivors or people in recovery, and schools all involved as kind of a core set of people who, if they attended the postvention response planning training, could then go back and be the backbone of their towns or colleges or school systems team to create a suicide postvention response plan. So I know Demetria is obviously new here, and I don't know who else might be new here today. just conceptually, suicide postvention response, we're not talking about just what do you do when a suicide happens like that day or that week with the family. What we're really talking about here is a community response, a municipal plan, or if it's a school or a college, a plan that's in place that says, you know, when this happens, who is sort of activated, who has training in this, who's thinking about, you know, the ripple effect on other community members, who's thinking about communications and safe messaging, what are we doing about memorialization, what are the touch points, like who's going to whom, when, not just now, but maybe, you know, over time. It's really, it's kind of like an emergency management team, right? Which a lot of towns have, but it's saying, here's the team when there's a suicide, in particular of utility when there are high profile suicides, that really have a big ripple effect, like if it's a kid in a school, or I think Val Babbage is on the phone, and I'm thinking about Westport a couple years ago when there was both a student and a teacher at the high school who died by suicide within a month of each other, and that just has a tremendous impact. So, you know, we were able to organize this training through the hub. We had about 90 people trained. And what we're going to do now is ask those of you who are a part of it for feedback. And we also asked everyone, the training concluded at the end of July, and we said, see what you can get going in your town and report back to us at the September meeting. So that's going to be now. I think, you know, I have no idea who the key person to report out by town. So I'll kind of go through a town list and see who can tell us what's going on. If you haven't had a chance to do anything, that's okay. Tell us, you know, who people can reach out to in your town, who's the lead, and maybe you have a date coming up where you're going to sit together and talk. So let's start with feedback on the training. Who would like to comment? And bearing in mind that some people weren't there, right?
I can say a few words if you want. Thanks. Gillian Anderson with my friend Abby. I have been working with Cornelia and a whole bunch of amazing people on postvention training in Trumbull. I'll let Cornelia speak to this, but I have just been so impressed. We've had a couple of Zoom meetings already. We kind of put this meeting as a deadline, so that said that we really, really needed people to be involved and report back. But we've had everybody from police and EMS and faith-based organizations and hospitals and the counseling center all getting together and putting a plan together. And you know, like you said, it's really kind of an emergency management team. And I'd love Cornelia to say a few words as well. And by the way, the feedback on the training it was excellent. It was really good. And I'm so, you know, as a suicide survivor, I lost my daughter. I'm really, really happy to see this effort being put in.
I mean, they can contact me. Right now, we're in the process of implementing a postvention plan for the town. We've been meeting monthly just to touch base and kind of see where everyone's responsibility is in case there's a suicide in the town. So we have a lot of stakeholders from the hospital, the funeral home, faith-based, social services, all around, and I'm excited about that. So if anyone needs any information, they can reach out to the counseling center and ask for me. Once the plan is implemented, because right now I'm in the process of getting everything in like a binder, just with protocol, like if something happened, what to do, yep, and all of that, and who's responsible for what, different roles, like the school, everyone have a part to play. So that's where we at. Great.
Cornelia, your name is popping up with a different last name. So
it's Morris. It's Morris.
It is still Morris. Okay.
Yeah.
And are you C. Morris or are you Cornelia Morris at Trumbull?
Cornelia Morris. Oh, C. Morris at Trumbull.
-ct.gov.
Yeah.
Yeah. Okay.
And then we also have a suicide loss group that we do every month too. So I don't know if you guys need that information also.
Yeah, I know that's gone out before, but I'll throw that down here in the other updates. that's meeting online still right now?
Yes, still Zoom.
And it's, just say what day of the week it is again. It's Wednesdays or
It's
something?
Wednesday, the second Wednesday of every month.
Okay. And if people want that info also, they can
They
get it
can
from you?
email me, yes.
All right. Great. Well, Trumbull, you guys are rocking and rolling. That is amazing. That's really amazing. That's fantastic because that's a lot of meetings to have had and to be moved, to be at the point where you're assembling the binder. And I
Yes.
think one thing we want to remind everyone is, you know, when you make a plan, it's only as good as people like remembering to implement it. And so touching base every once in a while, like maybe every 6 months, and like, does everyone remember what we would do when and if someone's job changes and someone new comes in, you know, you got to kind of revisit it. But that's great. So do we have anybody else who wants to either share feedback on the training or report out on what your town is up to?
Hi, Margaret, it's Ingrid. I can report out on Stanford. I see that Sarah's on our group. So from your training, which was excellent, by the way, we all identified that when we did the breakout group, that breakout group of 4 or 5 of us decided to continue to meet. And we've met, I think once or twice through emails, but today we had a Zoom meeting. We didn't realize this meeting was following, so timing was great. But our point of our group right now is in terms of readiness is that we are information gathering. So we realized today that we're going to reach out to child guidance. We want to see what the action postvention plan is for the schools. And we want to hear from Ted Jankowski, who's the leader, oversees all the emergency responders, because to your point, it is like an emergency plan. So those are our starting points in terms of kind of working towards that, what is actually in existence. And we feel that those are the 2 key people. And then we can move forward from there. But we also, just within our small group, have been sharing resources and identifying different things that we're doing around suicide prevention. So that's really helped to sort of build the rapport and keep us up to that. And, you know, we're a group of 5 right now, but the discussion have been really rich. We did do training, the suicide talk saves lives, training of trainers is one of the things that we've done since this last meeting. So we're not at the point of Trumbull, but we certainly are focused on this. So
That's great. That's really great. And Ingrid, are you the contact if people want to join the Stanford group?
well, I was waiting to see if anybody else could jump on, but yes, if they, yes, you know, yeah, we're very much a team, but sure, we would love to have them come on board. We have reps from Emergency Mobile Services and UConn Stanford are our, and myself are our main people right now. We were the people that went to your post-suicide training.
And did I just type your new email address correctly?
Yeah, yeah, sometimes I forget it. So yes, you did.
Okay.
Yeah.
Good. Other towns, and you know, if you're not sure what your town's doing, then we'll connect you to your town group. And if your town is not doing anything yet, then this might give you ideas about, you know, who to talk to get motivated, or other, you know, how other towns are organizing it.
Hi, this is Paige Miller from Stratford, so I can give the Stratford update.
Great.
So we have, those who attended the postvention training have had 2 or 3 meetings, and mainly just to identify community members and partners that we can bring on to our team as we move forward with the postvention plan. So it's been a lot of member identification and trying to figure out the logistics of how we would tie in the Board of Education and the town and what that plan would look like. Would it be a dual plan, Board of Education plan versus a town plan, or a cohesive plan for both? And we're somewhat at a crossroads at the moment. It's at a pause due to kind of a big member is the Board of Ed, and they want to kind of pause it for a little bit until they adjust to getting back to school with all of the COVID procedure. So we're gonna get back to it come mid-October.
Great. Yeah, Paige, I think we're all finding probably that everything that needed any kind of school involvement has ground to a halt right now, right?
Getting any sort of approval from the Board of Education.
Yeah, everyone's like, I don't have time for that right now.
Yes.
I can blame them.
So that's where we're.
That's great. And Paige, are you the contact for anyone who wants to get involved?
I am.
Can you, is it just P Morris Row or is it, what is it?
P. Morris Row, MORR, yep, at townofstratford.com.
All right. Anyone ready to go next?
Margaret, I'm representing Greenwich. We are developing.
Is this Danielle?
Yep, Danielle from Greenwich. Our group was with a 3-member group. One of our very important members retired from the school system, so we're kind of reinventing ourselves, and Demetria is now our new commissioner. So I have to admit that I did not know what postvention was until the invitation came, so I'm learning a whole lot, and thankfully Demetria is very resourceful. So we've had some meetings, and we have another meeting scheduled just to figure out what efforts have been made on the prevention side, who our resources are. I mean, we're definitely resource rich. We have a lot of partners, so we're doing some really great work, but we just want to make sure that we combine our efforts and streamline, and then we can actually, you know, responsibly talk about postvention.
Yep. That makes a lot of sense. And I know, I think Tina's on this call. A couple of you from Greenwich are on this call right now. If someone wants to talk to you about what's going on, which of you is the person to contact?
I think Tina, unless she's muted to say no. Either one is fine. She's muted.
Wait, actually, are you guys T Corlett at Greenwich, or how do the emails go?
I think she's tina.corlett at, and I'm danielle.sittol. So either one.
At greenwichct.org, right?
And it's .sittol. So I'm probably going to connect with Cornelia to pick her brain, because I did look at a lot of programs that were offered throughout, you know, in different kinds of communities, specific to certain populations. So those were really interesting. But we want to do a town-wide program, and, you know, obviously collaborate with the school, but we represent the whole Greenwich community, so we want to make sure that we capture supports for older adults, families, etc.
Yeah, I think, bringing in seniors is clearly important. Not, you know, youth seniors, thinking across the age, thinking of different demographic groups. Yeah, you made me think of something, but I lost it. I saw Genevieve on here. Genevieve, any report from Wilton or anyone else from Wilton?
Yeah, I'm here. It's good to see you. I thought the training was terrific, and we had a few people from Wilton who were able to attend. I know we have a list of people who've expressed interest in participating if we get a committee together. I saw Sarah Heath was on the call, so I'm going to defer to her because I'm not sure where things stand at the town level.
Okay, didn't realize Sarah was here. Hi, Sarah.
Hi, I am here. Yes, we're definitely going to be moving forward with this. I wasn't able to be at the training because of the timing of it, but I do plan on going over the materials, and it's not going to be for another few months because of everything going on, but we do plan to put a very small committee together. And I really appreciate this meeting because I look forward to following up with some of the towns that have done some plan already. Just to kind of hear a little bit more about what's working and what's not working. But we are going to be putting together a very small group, as I said. We just aren't going to be doing it for a few more months, give or take. But I really appreciate I've been at this meeting before and in these groups, but this meeting in particular has been really helpful. So thank you so much.
Good, that's great. Thanks, Sarah. And I think that's really, you know, it is an opportunity for people to see what the other towns are doing. For anyone who wasn't on the training and is wondering, or someone like Demetria who's new, one thing that happened at the training is we did share existing community or school suicide postvention plans from other towns in Connecticut. And Danique got another one. I think we shared 3, and Danique got another one since then that we will, I don't know if I have it to share. If I have it, I'll try to get it out to you guys. But you know, it's also another starting place, because you can look at, you can even kind of do a crosswalk of, oh, they had this kind of a policy, or they had this kind of a you know, decision that was identified. I like this one better. And so it can facilitate getting something on paper. So do we have anyone from Bridgeport? Do we have anyone from Easton? See, because I'm sharing my screen, I can't see all the participants at the same time. How about Darien? Fairfield, Riney, are you on?
Actually, Margaret, it's Kristen.
Oh, you made it. Hey, cool.
Yeah, I missed most of the first part of the meeting. Thank you to anyone on this call who's a first responder. Thinking of you, especially today with 9/11. So in Fairfield, yes, Riney, Noor, and myself are working together with Julie DeMarco, our Human Services. Riney and I are with Fairfield Cares. And we've had a few meetings, primarily, I think it was maybe Stratford who also said, we're really working to identify folks and we recruit them. So we've had pretty good success. Only one person said no after saying yes originally, but people seem invested and they're excited about the opportunity. We've had a few meetings. Riney's started to put some rough framework of things together for discussion, and we're scheduled to have a large group meeting on the 23rd following our Fairfield Cares meeting. So it's not a lot of substance in terms of planning, but the good news too is we're very connected. Dana Basio from Fairfield Public Schools was on the training as well, and all of us were, which was great. So we're definitely going to do a joint plan. We feel pretty strongly that doing it together as a town makes the most sense for us, because you know, while it may be a school student, it's the police and fire who are responding, and there may be, you know, members of a church or synagogue or faith community. So there's a lot of investment in working together, and I'm excited. In addition, I think that Julie, because Easton is so small, I think Julie invited them to participate in the conversation with us, and we have the tremendous added benefit of the fact that Valerie Babich is also here in Fairfield and is going to help. So I'm excited about that, because I think that cross-pollination, sharing of ideas, hopefully will just help us all be better and stronger.
That's great. Val, are you on this call today?
Yes, I was actually gonna just jump in. I'm sorry, I'm multitasking. As you mentioned, schools are a little crazy right now. And I'm not sure if anyone Department of Human Services is on from Westport, but Kevin Godburn and Elaine Dano and I did meet after the training. We all found it very helpful. And we started to talk about who we would invite to be part of our community postvention team. So we had left off, we kind of divided up the list, who was going to reach out to whom, and then offer up a training so that everybody has the same information and is trained. Should something happen, they could immediately step in. I'm also going to work on developing a suicide response manual. All the resources that were shared were really helpful. So that's the plan from my end. I have a lot of crisis intervention material that we've used. As you mentioned, we had those previous suicides, but I have not had the opportunity to really compile it in a way that is a more formalized plan. So that's kind of where we're at. It's just, you know, in terms of the school and working on anything here, it's sort of at a standstill right now as we just settle into our new routine. So I'm hopeful we'll get there, but it's just moving slowly.
That doesn't sound slow at all. I think that's impressive. So I realize in my notes here, I want to capture who should people reach out to if they want to work on this in Westport and Fairfield and Wilton.
Yeah, I think, you know, Department of Human Services is really spearheading it. You know, don't usually like to volunteer others, but I do think Elaine Dano is sort of taking the lead with that. But you know, I'm happy to address any questions if there are.
Okay. Does it look like I just got Elaine's email right? Anybody? eDano at WestportCT, I think, .gov.
That sounds right.
Okay. And Kristen, who do you want people to reach out to in Fairfield?
So we're we're doing
Don't
the
say
dance
you,
with
don't
that.
say
You're
you.
just, well, for now, I'm not going to volunteer Riney because she's not here, but just for now, me, but we're going to identify someone who's not me. But for the moment, I'll take it and share. And that's the other thing I actually meant to follow up. One of the really wonderful things that Riney did for us was to create a shared Google file. And in the Google file, it has the spreadsheet with the names of folks, who's asking who, the status of whether or not they've been contacted, their contact information, so we can each add it ourselves. And then also the documents from the training. And it's really great because we all have access to it and it's linked and can be shared then with the new members coming in, so they can just go to one place and look at it.
That's really smart. I bet everyone's making note of that. Kristen, what email should people use to contact you about this, but only temporarily?
Yeah, thank you. Just my full KristenMcCarthyVahey@gmail.com.
And Sarah, if people want to get involved in your, I mean, it sounds like in Wilton, you guys are thinking about kind of a task force approach. So if they're interested, would they just contact you and you'd work that out?
Yeah, I think that makes the most sense. I can definitely be the contact person at this moment.
All right. Can you tell me your email address?
Sure, it's my name, Sarah, sarah.keith@wiltonct.org. Thanks, Margaret.
Thank you. All right. Do we have anyone here from Weston? Or Monroe? Or New Canaan? We have pretty good representation here today, actually.
Bethany Zero was on. I saw her.
Okay.
Maybe she had to leave, but just FYI, it was Bethany.
Okay.
I'm calling her out.
Yeah, exactly. So talk to Bethany if you want to do it there. I can give a quick Norwalk update. So Norwalk, we've only had one meeting since that time. We had the breakout group, or Danique ran the breakout group on the last day of the training. And then since both Danique and I are going to be part of the Norwalk postvention planning, and we both changed jobs this summer, we've only had time to have one meeting since then, but we have a schedule where we're literally going to meet weekly for an hour for the next 4 weeks in a row. We have a pretty good sense of who needs to be on that team. There's a little bit of outreach happening for 2 weeks to kind of get some more people there. And our goal is to have a draft in about a month of the plan. And then, so kind of the Wilton approach, I think, like sort of small task force approach. And then, you know, as there are other people that may feed in, train them, explain it to them, whatever. But I think we're really trying to help the town see that there's a town role here. And as much as we want to have lots of, you know, the more the merrier, on the other hand, there are certain key parties that just have to kind of be involved. So I'll let you know if that works to have this really time limited approach to getting it on paper. But I guess if anyone wants to work on that in Norwalk, they can contact me. And so I think, did I miss any towns? While I write the Norwalk notes, if anyone wants to comment on this, anything else to add, and then we'll keep going with the agenda. Oh, I guess the other thing on the agenda may have been covered, but does anyone feel need for more support or help in this process? Does everyone have access to all the documents? Like, you all know how to get everything that we sent out during the training? I guess I would mention that even if you weren't at the training, the people who attended, I know I sent an email at the end of every, like within the day of each training, sending out documents, because Tom Steen, the trainer, really gave us a lot of different useful documents. And also we recorded the first 2 trainings and put them on the Hub's YouTube channel. So if anyone didn't see one of the trainings, they can go and watch it on the YouTube channel. We also recorded the 3rd training, but since most of that was in a breakout session, we didn't put that on the YouTube channel because there's really nothing to see. So the Hub's YouTube channel is the Hub's CT Info, and you can watch those videos there. So it looks like we can move on to our other updates. And this is literally, so the rest of the agenda is other updates from anyone here. What else have you been doing that's related to suicide? I would say, what have you already done recently that you want to share with us? And it's Suicide Prevention Awareness Month right now. So if you're running any trainings, if you want to host a training and advertise it before the end of the month and you're looking for a trainer, let us all know. But we're going to do other updates. And then the next steps right now are really figuring out a prevention subcommittee. I'm going to take off the post-vention committees because we just went over that. And I'm just going to show you that right here, the next quarterly meeting dates are all on this schedule here, but they're literally the 2nd Friday every 3 months at the same time. So in terms of updates, Cornelia mentioned the suicide loss group, and that's not just for Trumbull residents, right? That's open to anyone. Jeff mentioned his new peer support groups that are meeting at night.
Yeah, that's open, Margaret, that's open to everyone. It's not just for the town. It's open to everyone, the different communities all over the state.
Great. I will say that before I left the Hub, one of the things I sent you guys all and updated was that suicide resources page that we have that I think is nicely enough formatted that it's supposed to be something you could hang on any bulletin board anywhere you go, like Starbucks when they're not looking. And it has the cell phone drawing in the middle, and that lists the suicide lifeline and the crisis text line. And on one side, it lists other resources like healing conversations and prevention tips. And on the other side, it lists all the suicide loss groups in our region, including the Trumbull one. So we can send that back out if anyone doesn't have it and share it. But in other words, it is updated for 2020 with all the different suicide loss groups that are happening in our region, and they are all meeting online. So there are a lot of options that we want to make sure people know about. Any other updates on things you have been doing or are planning for Suicide Awareness Month? I see a couple people who have to
Hey, Margaret, I have something real quick from my friend Abby. We have a very active young adult committee that meets every week online on Monday nights at 7, if anyone is interested. I would say the age range right now is 15 to 26. And it's a very active group, very informal. And the other thing is that my friend Abby is giving out grants. We have a new grant cycle, and we're giving out grants to young adults who are taking action and doing something about mental health. And our theme right now is back to school and coping with COVID. So it's a very simple grant process. You can go to myfriendabby.org, go under grants, and I will send an application to whoever is interested. And we have kids that are applying from high schools and colleges. We've had to pivot just like everyone else, so we don't have our larger events. But it's amazing what these young adults are doing and talking about their mental health. So again, if anybody is interested in getting involved in My Friend Abby, you can go to myfriendabby.org.
Great. And the grants page is just /grants, right?
Yep.
Awesome. I can give a couple of updates. One is that Lee knows this as EMS chief. Before I left the hub, I worked and had a student from Wilton actually who participated, but we wrote a small grant to the Fairfield County Community Foundation, having discussed it with them previously, so I'm encouraged to think we will get it. And that would bring 2 types of trainings to the region, particularly for EMS. That would be the target audience, because first responders, we know, have significantly higher risk of depression and suicidality due to the trauma, kind of the traumatic nature of their work. And then COVID probably worsened all of that. So if we get the grant, we will be able to offer an assist 2-day suicide intervention training for EMS from the region. And then the idea would also be that, you know, and that would be really for probably 2 people per department. So they could bring those skills back to their department. In addition to which, we would just try to coordinate among all of the resources that we have in the region to make sure there is at least 1 QPR offered monthly for EMS. So any EMS person from any department could go and get QPR trained. So everyone that works, that's an EMT, would basically have some type of suicide prevention or intervention training. So I was excited about that. I'll let Susanna Lewis, if she's still on, talk about the mental health first aid training grant and where that may stand. And the other thing I want to mention is that New Vance Health, which is Norwalk, Danbury, and New Milford hospitals, as well as some hospitals in Westchester, during COVID, they rolled out a program called PACT, which stands for peer, you know, it stands for something that I can't remember, but it's a peer support. It's an in-house peer support system for the healthcare workers, the doctors, the nurses, and it's really about, you know, reaching out to each other and empathizing, because they're in the same shoes, going through all the stress of healthcare work generally, but COVID more particularly. So they just invited me to do an add-on suicide training for them, and I just last week did 2 trainings and trained about 100 doctors and nurses around suicide. So I thought that was really exciting. Susanna, do you want to say anything about the grant? Or she could be off the call now. I don't see her here any longer. So I will just mention that this was another thing, you know, really coming out of this work we've been doing in the last year is, you know, knowing that suicide prevention starts with mental health promotion, and knowing some of the at-risk populations and youth and young adults. Mental health first aid now has a new program called Teen Mental Health First Aid. And so I started working on whether we could submit a grant. This was an idea that Kate Venison suggested. Oh, Kate, you're still on the phone, so you could talk about it, but we tried to come up with an idea for a grant, again, a large grant to the Fairfield County Community Foundation, to have them fund a training of trainers so that we could get health staff from all the high schools in the region trained as teen mental health first aid trainers, get those schools' commitment to then roll out the teen mental health first aid training as part of their health curriculum for mental health and substance use, and therefore be able to bring a really, you know, evidence-based or substantial level of training to the entire region and graduate entire grades of kids who've had this pretty intense curriculum. And so there's more to it, because any school that would want to implement, or any youth serving organization that would want to implement, would also have to make sure that 10% of their staff and their adults are trained in youth mental health first aid. So we started working on assembling a grant proposal. I was still at the hub at the time at RIASAP, and we were prevented from applying for another grant because we had one with the Community Foundation, and Silver Hill Hospital was amazing and willing to step up and is submitting that grant on behalf of the region. So we'll keep you posted with where that stands. Anything else you guys are doing? Is anyone doing any kind of suicide training this month for Suicide Awareness Month? Okay, then let me actually ask the question. Oh, I have a document I have to share. But let me ask the question, since it is Suicide Awareness Month, if any of you is really looking to provide some kind of suicide-related training in your community during September, or really why not anytime, I'm going to share with you, the list of all the different types of behavioral health trainings and trainers that are in the region. That was updated as of, I edited this before I left the hub. I don't know, I can't remember if it went out or not. I think it might have, but on this call and through the networks that the hub has, there are trainers. So if you want to schedule a training, let us know. So this document lists different types of trainings. I just want to highlight, it's called the Inventory of Trainings. The actual training agencies and individual trainers are listed at the end of the document. What you can look at here is by topic. So mental health awareness trainings. What's out there? There's mental health first aid training that we all know is very commonly offered. It's got a check over here, which means it's an evidence-based training. There are all these modules, adult, youth, public safety, etc. The teen one is the newest one. Currently, mental health first aid training is a hybrid program because it's 2 hours of people doing their own work online and then 4 hours with the trainer online. So people like Kate who are on the call are trained to offer that. But it is a new model during COVID that I wanted people to know about. So mental health first aid or mental health trainings, here are a whole variety of them. And in the last column, it tells you who to contact if you want to offer that training. But the idea of this document is it's a checklist. So if you're looking for a type of training, you can go, I want it to be 1 day long and focused on youth in colleges. Oh, it looks like I want the fresh check day training. Okay. Then this next page is suicide awareness and response trainings that are available. I want to comment that the 5-year state prevention plan that we looked at the back of the document, they list a whole lot of suicide training. So that's already a resource for you. This is supposed to be specific to our region. And you'll see that at the end, it's kind of like, who could you contact in the region to schedule the training? So we have a ton of question, persuade, refer trainers in the region. Some of us speak Spanish. I'm actually going to be doing some Spanish trainings at NCC next month. If you're looking for QPR in Spanish, I can help with that. And I think there's some other folks who can as well. Assist that I just talked about, Safe Talk, Signs of Suicide, which is really focused on schools. Talk Saves Lives. Last year, the hub did a training. We have 35 people in the region who can deliver that. That's really less of a skills training and more of an awareness presentation. So I'm just scrolling through this document, substance misuse prevention trainings that are available, recovery trainings. And then here at the end, any agency that was listed in the right-hand column as, here's who you contact. The agencies are down here. And then on this last page, some of the people in this region who can train in these things are listed. So they're listed alphabetically by the person's name because a lot of people who can do one training can do multiple trainings. So I just wanted you all to see this. I'm pretty sure you got this at the end of July. I think I sent it out while I was still at the hub with some other documents like the minutes of the last meeting, but I wanted to make sure everyone had seen this. Does anyone have any questions or corrections on this as you're looking at it? None. I don't know, at this point I'm going to stop. Oh wait, you're going to talk about the prevention subcommittee. It looks like we still have 19 people on the call, so I didn't know if everyone just dropped off because it got really quiet there. Any other thoughts, questions, trainings, anything like that? Okay, so can someone let me know if you remember getting that training document?
Can you resend it? Margaret, I don't remember if I received it. I remember seeing it.
Okay.
I think we had talked about that list, but I'm not sure. I have
Yeah, because we first talked about it like way last fall, and then people gave us updates, and then I don't know if we sent out an interim one. So I know in July I sent something out. So I'll reshare it. And by now, it's also possible there are new changes in there. So feel free to send
thank you.
comments to the hub about that for updates. All right. So I guess the other thing we had on here was, next steps. So we said we wanted to have a prevention subcommittee just because there's so much prevention work happening in all our towns, and the funding is for substance use prevention. And a lot of times the prevention subcommittees, the LPCs are trying to do suicide prevention work. It's all, I think they may feel like they're the only ones left to do it. But then there are all these other people. So I think, that's not necessarily that they may be the location in their town, but then how are they networked with others doing suicide work? So I think those were issues that were in our minds when we said, let's have a suicide or prevention subcommittee. But now earlier in this conversation, we raised the question of whether our committee should really more match the priorities in the new 5-year plan. So it's now, I'm throwing this back to you guys. What kind of structure do you want us to look at doing? Does someone want to say, I would like to chair a prevention subcommittee, or I would like to have a follow-up meeting to talk about this more? You guys tell me what you're thinking.
Margaret, this is Jules. I'm sorry, I speak a lot.
I'm glad. It's really quiet right now.
My thought about having it's like a strategic plan. And so when you have a strategic plan, you think about what are the activities you can do on the ground that feed into making those goals happen. And so I think that's a discussion. What are like the actual activities that we can do towards, let's say, goal 1A? Even kind of brainstorming those things. Not that we always want to go back to planning, right? We want to move on to action, but that can help facilitate, like, what are the things we can do? We can't do everything, but there's certain things that we can do as communities, as schools, as, EMS staff or whatever, where people can kind of think, well, how from my area do I come towards closing in on this goal? Mm-hmm. And so that's just my thought. It's like, that's a high level thing, but how do we bring it to a local and implementation action place? That's just.
I like that, because I think, when we started this last year, the first meeting was last September, right? And one of the things we did, for those of you who are here, if you remember, we did stickies along a continuum. We went prevention, intervention, postvention, grief support. And we said, what are the types of activities that are already happening and what's coordinated or not coordinated? But we identified that there were gaps around intervention and postvention, and that what was happening the most was really prevention, but again, not necessarily planned, like planned maybe within communities, but sometimes more just based on availability than targeting. So I would say that really, last year, looking at intervention and postvention maybe being like the biggest gaps, we've written a grant proposal to try to do assist intervention training, but for one target audience. And now we've we've built some capacity around postvention and are moving that forward in our towns. But those were like 2 work plan activities that occurred as a result of identifying gaps, but we never came up with a full work plan. And now we've already sort of moved those things forward. So it's a good time at the beginning of the year to go, what are our goals for this year? And what would be the sort of regional, what are we trying to accomplish this year as a region? And then people can then drill down and go, my part is this, or my committee is that, or my town is doing this. I guess the question for you guys then would be, is that something we would wait until our next quarterly meeting to do? Which would be okay, but that would be December. And we're all pretty busy getting back to school and work and COVID. Or do we want to have some kind of subcommittee that wants to dig into the strategic state plan and think about implications for the region and do something in between? Or is that really the focus of the December meeting? What do you guys think? Anybody besides
So
Cornelia?
can I ask a question?
Yes.
This is Kristen, and I think, as you know, that I'm not going to be directly involved in probably any of these things, but I'm incredibly grateful that these are happening. One of my questions is, who's the administrative support for this group? Is it through the hub?
It's the hub.
Okay.
And
So,
and let me just mention with the hub, so Giovanna Mozo is coming back from maternity leave next week. She'll be part-time at first, but she will be back. So, and the hub is bringing in a new coordinator. I think they're planning in the next couple of weeks, is what Janice told me. So, so they would be staff. So anyway, I wanted to insert that, and Kristen, back to you, because of course they're going to be the ones who are going to have to think about what next. So we shouldn't commit to anything here, but I think ideas, you know, they'll watch this video and think about what they wanted, how to approach next steps.
Right, and that's partly why I was asking, was you were talking about different grants, and you were saying you've shifted roles, and I'm just wondering, as you know, all of these things take leadership, time, effort, energy, and that, you know, that's part of an outstanding question I have in terms of how that works for this group going forward. And I will just say, I want to thank you and everyone else who's here, because of course this is a group I'll jump in and out of as I'm able to, where I know that it takes people being here day in and day out to get this done. So thank you.
Thanks for always making time for this. So, you know, if someone doesn't have any thoughts about this, I think maybe I'm not hearing anyone go, I want to chair a prevention subcommittee or even a meeting to talk about and coordinate that. And I think, you know, Jules has raised a really good issue, which is, you know, why not, and Kate previously, why not relate all this to how, you know, what is the strategy for this group for the year, or what are the regional goals? And then how do we break them down? Knowing that this group meets quarterly at this level, you know, one option is of course going to be that they're just quarterly meetings where people just come and share things and learn new resources and talk about what they're doing and hear from the state level. Another option is having subcommittees and in-between groups that do more. And I think any goals or work plan have to reflect the actual structure, and vice versa, right? But we definitely can't set a work plan that involves getting a whole ton of stuff done and then only have 3 more meetings in the year. So I think there's some decisions around that. And I think given that we've talked about all those possible options here, you know, people can watch the recording and give it some more thought, and maybe send any comments that you have to Giovanna, to her email, and which I'll put in the chat right now, so that she can kind of cogitate on that stuff too. Giovanna Mozo at thehubct.org. And I see that Lee has commented, I think the challenge is trying to create small bite-sized objectives and subsequent action plans. She's hesitating to answer because it's so broad. Where to start? What would the smaller groups be? What would be the deliverables? How to get there? Yep.
Margaret, I just feel like I want to take something away and go work on something for you, but it's just so broad, and I don't know where to fit myself in with that. You know, I don't even know how to start to give us that breakdown and then for each people to be able to say, I'll work on this one piece.
Yeah. Yeah. Well, I don't think there's any way without people going through somebody going through the strategies and then kind of bringing it down and going, this is happening here, or this isn't, or this is a gap, or this is what we want to work on. I think it's really okay if we want to say as a region, we're working, right now we have basically 14 towns working on post-vention response planning. We didn't have any towns doing that before, right? We should give ourselves a pat on the back. That's actually pretty great. And when people have their post-vention plans in place, then you've built some awareness, you've activated some people around this topic, and you have a plan for when the suicides may happen, and hopefully they won't happen. But then, so I don't think we have to feel like, oh my God, we have to do more this second either. I think what a takeaway can be, that's happening. I can be a part of it. It is Prevention Awareness Month. You can all share something on social media related to that. Maybe the takeaway is really, I'll send back out, or I'll get back out to you through the hub, the suicide resource sheet and that list of the inventory of behavioral health trainings. And maybe the only next step right now is make sure those have circulated to people in your town and people have paid attention to them and thought about trainings they might want to offer, or just getting the resource sheet out on bulletin boards or on social media so that people who are struggling know that help is available. Any other thoughts from anybody?
I'm sorry, this is Jules. I'm going to chime in. I was going to type it, but I'm not that quick. You guys have done an extraordinary amount of work this year. I mean, it's incredible what you've gotten done. That list of all the trainings and who provides them, that's huge to have that in one place. The prevention plannings and just doing the post-vention training for everybody. I think it's amazing what this group has done in the past year.
That is very nice to hear. Thank you. I mean, we really want this to all be a group effort. I was really happy to see so many people on this call today, and seeing, we've got people, we had, I think, 3 or 4 people here who are leading support groups. I think Ashley and Christopher had to get off, but I saw them in the chat, and we've got, everything from the peer support workers to the frontline people like Lee. It's a great group here. And I do feel like I've been talking a lot, but I think it was like present stuff and get feedback. The fact that we have all these towns working on this is amazing. I think everyone should be really pleased with yourselves, and thank you all for your work. So I believe that I'll type a few more notes here if there's anything else that I didn't get down. We can wrap up early. The next meeting will be December 11th from 12 to 2, unless you hear otherwise from Giovanna. I will make sure anything in the comments gets captured in these notes, and thank you all so very much. Have a great day. Oh, Lee, I see the education plan idea. That's a good one. Thanks, Jules and Danielle. I'm seeing these comments. Really nice to see you guys.
You too. Have a great day.
Thanks. Take care. All right. And Jeff's still here, and Tina. Tina, I want to see your face. I haven't seen you in so long. But I shall not see her face. Jeff, I always love you surrounded by your technology there.
Yeah, I've been getting more of it. I don't know if it's an addiction at this point or not.
It could be, right? What else to do during the quarantine but go on Amazon and buy stuff, right?
Well, a lot of this stuff I had laying around, I just decided to hook it all up.
Oh, hang on, I didn't stop recording.